There we go. Okay.
Okay. So welcome back, everyone. I hope you had a good lunch. You all know each other. You've been here all morning, and you know Sharon, who's my co-presenter today. So let me introduce myself. I'm Jillian Early. I'm a licensed clinical social worker here in San Diego. I work part-time at UCSD in their Women's Reproductive Mental Health program, and I have a private practice in Bakersfield as well. And I hear that you all have a lot of experience and questions, feedback, and ideas. So certainly welcome your participation in this course as well. And in the interest of time, we may cut you off occasionally, and I hope that's okay. But we'll just try to keep things going. But we really do welcome your input and your discussion points as well, because I think we learn so well when we are able to learn from each other. So to get started, we are here for 102, so we're continuing the healing journey in this section of the day. 101, you covered the broad strokes of how do we enfranchise grief, how do we ask the right questions to support people going through a reproductive loss. We know that reflective listening and all of our clinical skills are so important to help create that safe place for people to disclose and then be able to get support around those losses. Here in 102, we're going to go deeper. We're going to be looking at, assuming that we have multiple sessions and this is what we're working on with our clients, what could that look like, and what are some ways that what are some considerations we want to have, and how do we want to work through that and support them through this. Again, with that non-pathologizing of grief experience. We're going to talk about how we continue with our ongoing clinical assessment. So from that first session, but all the way through, even through the end of our work with our clients, we're assessing for what's going on for them and how we can best support them. We'll cover some frameworks for case conceptualization for working with reproductive loss that could be potentially helpful to integrate into your practice. And we have an overview of a unified protocol for healing, which is kind of like a treatment planning approach for working with reproductive loss or other concerns too. So we'll talk more about that. Sharon and I will be tag team presenting today, but I'm going to lead us off. So just reflecting, and probably you all are here because as we reflect on the research that's out there, the training that's provided around supporting clients through reproductive loss, there's not a lot out there, right? There's not a ton out there. It's not something that we talk about very well culturally, and we certainly don't address it very thoroughly in our training programs. So bravo to all of you for being here and seeking this additional support and training in this area. And we really, this quote, physicians and medical professionals can play an important role in reversing stigma and social attitudes surrounding stillbirth or other reproductive loss, first in communicating directly with patients, but also by speaking out on this issue in published work or in the training of future clinicians. So thinking about, for you, what does it mean to be here, working and incorporating this into your work with clients, but also taking it forward? How can you maybe contribute in some way to sharing this message with other clinicians and supporting people through that? Okay. So our goals and objectives for the course today. We hope that as a result of participating in this course, you will be able to leave here feeling like you understand the relationship between grief and trauma related to the healing process. You'll be able to formulate a comprehensive assessment incorporating reproductive loss. You'll be able to apply evidence-based theoretical models for conceptualizing grief. You'll be able to establish, discuss, and evaluate treatment planning and learn and implement at least 3 interventions. And so if at any point along the journey you're like, wait a minute, I don't quite get how this fits, but we'll wrap up with that too and hopefully answer any questions that are lingering by the end. And as we said before, please share your experience and contribute to the discussion. It's great to learn from each other, and we really want to empower you as clinicians to be able to work with this topic and work with your clients and empower your clients to go through this. So we're going to jump in to trauma-informed care and how this can relate to our work with reproductive loss. Who here has heard of trauma-informed care or done any training in trauma-informed care? Yeah. It's really, really important, especially as we open up these really painful places of grief and loss, that the potential for overlap with trauma and trauma reactions, that we know how to take care of ourselves and working through that. So trauma-informed care is the ability to promote a culture of safety, empowerment, and healing. And we do recommend that clinicians do take some sort of trauma-informed care preparation if they're walking into this kind of work. We know trauma is super prevalent, right? In the United States, 61% of men and 51% of women report exposure to at least one lifetime traumatic event. And 90% of clients in public behavioral health care settings have experienced trauma. So this is everywhere, whether we ask about it or we don't, it's there. So thinking about it in all of our case conceptualization and assessment is really important. How that relates to reproductive loss, we don't assume that reproductive loss is a traumatic experience for everyone, right? But the potential for that to be a traumatic experience, big T, little t, is there. And so we want to have this lens of how do we help support people through that and assess for that. Are they having a traumatic reaction to this experience? Jackie and Diamond, who you all heard about in 101, are local authors of reproductive trauma. They remind us that those who've experienced perinatal loss are often hesitant to seek therapy and feel a sense of shame for doing so. That these patients may already feel like failures physically, and the need to seek therapy to cope is seen as yet another defeat. They further note that some clients may experience feelings of extreme vulnerability and desperation. They recommend stating that the client's experience can be traumatic. Naming that, right? They emphasize that the therapist is there to provide support and understanding to help them during this extraordinarily difficult time in their life. It's important to dispel the belief that there is something wrong with them for needing therapy. Therapy needs to be normalized as something very appropriate and viewed as part of their self-care during this time. Right? So, oh my gosh, why am I not getting over this? What's wrong with me? This is a really normal thing to need to seek support for this. Right? You're in the right place. We've found that in the studies that are out there, reproductive loss often correlates with symptoms of depression, anxiety, and grief that can extend for years. And so, again, kind of screening anyone for reproductive loss histories is really important. And being able to address that if that comes up. Those symptoms can extend, as you can imagine, beyond the subsequent pregnancy as well. So as you reflect on your own readiness to do this work and sit with people in these experiences, we're going to talk a lot about how we do that in this course, but just taking a moment and reflecting on your readiness to do this trauma work in general, being aware of the burnout that can be related to working with trauma day in and day out, compassion fatigue, anxiety, depression, and triggers for you as a clinician, and thinking about ways that you want to take care of yourself. So we started talking about self-care at the end of the last course as well. That's an important thing to be continuing to think about. And so as you ask yourself, am I ready to work with this population? Have I done my work around my reproductive story? And if not, can I get some support around that or work through that in my own time or in my own way, right, with the tools I've learned? And do you have losses that you, perhaps not reproductive loss, but other losses that have been resolved that you can reflect on that experience? And the other piece is thinking about where you work. So I know a number of you are in private practice, so you're your own boss. Hopefully you're kind to yourself. But sometimes we have systems that are maybe invalidating of our experience as clinicians working with trauma. And so thinking about do I have safety in my environment, in my workplace? How can I create that for myself and for my clients? If I don't feel safe, certainly my clients are going to feel safe. Yeah? Okay. And again, as with 101, if you're finding yourself triggered or feeling like you need to take a break for yourself at any point, kind of emotionally, or just please be mindful of that, and we welcome you to do that, or check in with Sharon or me at a break or afterward if that feels helpful. So, promoting empowerment in our clients. We're going to overview a few different ways of addressing this and tending to different components of how we can really promote that empowerment in our clients. We're going to talk about the difference between treating and companioning, cultural competence and cultural humility, how we can use a collaborative process to really empower our clients, how we can understand microaggressions and the impact on the relationship, and how to work with resistance in a client. And really, on that last point, we know when we are going through or we have a painful experience, it's a pretty natural reaction to kind of guard that and try not to think about it and try not to feel those feelings, right? And so even if someone's like, I know I have this thing and I should talk about it, but I don't want to, right? We may get in that dance. And so just knowing that by staying and using some of these tools and techniques and just being able to really be with our clients and their experience, we can help move through some of that resistance and some of those stuck places for them. Okay. So, moving on to treating versus companioning. Treating, we can see, kind of comes with its, the more medical model approach. We kind of think, okay, I've got my agenda, I want to fix what's going on. Medication may be kind of a more quick response in a treating approach. Certainly medication is often and many times necessary, but it's not, we don't want to pathologize grief and loss, right? And so being aware, are these symptoms, do they need medication, or are we working on some therapy approaches that can help them move through this, where medication is not necessarily the first line approach. And so you're all clinicians working on that piece of things. As a treating kind of clinician, we may be uncomfortable with silence. We may rely on being the authority figure and guiding the course of the treatment, and kind of create this dynamic of I'm the expert and you're the client, and let me tell you how to feel better, which doesn't always feel good. And we know from best practices in counseling grief and loss that is not the most effective approach. So to shift gears and look at how companioning and how a companioning stance could be more helpful to our clients, and to contrast that, companioning we see as listening with the heart, bearing witness with no judgment, walking alongside a client through their experience, not leading them through, being able to sit and be silent with our clients and just experience that with them and not feel like we need to fill that with something, respecting their lack of order and confusion that may go with their loss experience, and kind of their emotional impact and the timeline that could be, first now we're talking about this and now we're going way back to talk about that, and just kind of being with that. And we really want to bring a stance of curiosity rather than expertise as we take a companioning approach to our clients through this experience. With this approach, companioning focuses on the relationship with the counselor as the client feels understood, valued, appreciated, and supported. It is more of a collaborative process. That can really invite, you're waiting to see where the client is. So you're inviting that collaboration as you go. Professional boundaries are, of course, clearly defined, right? This isn't just like, hey, let's hang out and get coffee, right? You're still the clinician and you're still with them in a therapeutic way, but you can define that, and then you can also be there with them through that. This approach also can promote empathy, right? You're really settling into the client's experience of where they're coming from and how they're moving through this. And so we can often see things better from their eyes or from their lens by taking a companioning approach. Many people fear judgment or criticism after experiencing reproductive loss. They're trying to avoid shame and guilt related to any choices that were made or any loss experiences that were had, as you guys talked about earlier. We, through our ability to actively listen, bear witness without judgment to their stories, we're able to create that safe environment for them to do their healing and create that sense of relief. Like, am I crazy? No. Here you are. This is totally okay, right? There's no one way to feel about this. There's no right way to feel, but I'm here to support you through this. Tell me more. So as you reflect on maybe clients that you've had or interactions you've had for your clients with trauma, that's a pretty normal experience, especially someone without pre-existing mental health. They're like, I am losing it now, I must be going crazy, right? Even folks who have chronic mental health conditions, they may kind of confronted with this experience have like that, I'm losing it, or everyone says I should be feeling better and I'm not, and so I must be doing it wrong, right? And so just being able to companion our clients through this and help them feel safe, heard, and understood, and then help them kind of continue their journey. Okay, so I guess to summarize that, we would really encourage you to take that or consider using a companioning approach as you're working with clients, as you walk with them through grief and loss experiences. Questions or concerns about any of this so far?
I'm just listening to this. It seems like that that second list on the right definitely would be a better approach in terms of like what you're talking about with empowering the client.
Mm-hmm.
I do wonder though, because sometimes there is a client that comes in and says, I don't know how to do this.
Yeah.
I need to learn how to do this. And so that puts you in a little bit of a tricky situation as a therapist to do more of the stuff on the left, but be mindful that there's an approach.
Right. Yeah, and we aren't walking alongside someone and letting them kind of veer off course or get stuck somewhere, right? We're going to walk alongside them and say, hey, like I see that you're trying to get here. Maybe we can talk about some ways around this, right? But not like, I know what you need to do, right? That just feels so different. So yeah, I appreciate that. And sometimes we do have to take a more active role in providing psychoeducation or providing tools or examples of tools to our clients to help them work through a stuck place. Yeah. And I can just think, I do a lot of groups in my practice, and one, just this idea of like non-judgmental companioning, being able to support a safe environment for people to say, whoa, like, I'm not alone in this. There's other people who are experiencing similar things to what I'm experiencing. Like, that is so, so powerful, and I can't say how many, usually moms I've worked with, that just that kind of like that answer to, am I going crazy? When they realize like, oh, I'm not. It's like, oh, okay, now the healing can start. Now they can do some work. Nextly, we're going to talk about cultural competency and cultural humility. Right? A lot of times, cultural competency is kind of the buzzword, right? We want to go to trainings, we want to learn a lot of information about different cultures and clients so that we can be there for them. Absolutely, that's not wrong. And actually, I think you have a handout in your folder that talks about, you can reference either after this or as we talk about cultural humility, self-assessment, and therapeutic considerations. And Jackie and Diamond talked about cultural competency, and I think you talked about this in 101 as well. But to emphasize again, what is crucial is that the therapist is aware of the cultural expectations and interpretations of loss to help couples and others through the grief process. Sensitivity to the similarities and differences of the patient's values to one's own values is essential. And so that kind of awareness, and they're really speaking to that relational awareness of culture and the role of culture in the room, right? And so cultural competency is not, it's often thought of like, what do I bring into the room so I can be culturally competent? Cultural humility and adopting that stance is really committing to an ongoing process of reflection and examination in the therapy room. And okay, that's a blind spot that I had, and that, like, let's work on repairing that, and let's talk about that. And I don't want to make an assumption about how you are experiencing this or where you're coming from. And so that ongoing commitment to your own self-reflection, your commitment to address power imbalances in the room, maybe outside, and partner with and advocate for marginalized folks is really important in this cultural humility approach. I have a quote that says, cultural humility involves more than gaining factual knowledge and ongoing attitudes toward both our clients and ourselves. Cultural humility is one construct for understanding and developing a process-oriented approach to competency. And so this kind of speaks to your question too, or your comment that, I hold an expertise in a certain body of knowledge, counseling, maybe grief counseling, or other kinds of perinatal mental health counseling, but the client holds the expertise of their experience, and really holding that as true, and supporting them and owning that and deferring to them as the expert in their own lives. And then you can collaborate in that experience of, okay, so here's what I bring to the table, here's what you're bringing to the table, how can we make sense of this, right, and help you through this in a way that works for you. And at this time in our culture, we know the consequences of not practicing cultural humility within a therapeutic context will likely have a profound negative impact on the therapeutic outcome. We'll talk more about that as we move on to talking about microaggressions on the next slide. But is that, any questions about that? I think one example for me is working with folks who may be second generation immigrants to, I'm born and raised in California, they're born and raised in California, but they have a whole host of cultural complexity coming with them when they're dealing with reproductive loss. Not only is it, okay, I was brought up in California in the same, similar age bracket as I am, and like what else is going on here? What else is influencing your beliefs about yourself or this experience or what it means to have a loss? And so that is something where I've seen that come up for me in my practice. I don't know if anyone has examples that you want to share how cultural humility or cultural concerns have come up in your practice and how you've addressed them.
I was supposed to say, I have not so much through reproductive loss, but I have a Nigerian gentleman that I work with, and so there's a lot of, he's not very good in like social situations, and so we do a lot of processing on like, well, this is the this is how I think in this situation, and then like me really having to understand what his perspective is of it coming from Nigeria, and then me like kind of informing him, well, being from America, I can let you know that this tends to be the way that people think in this situation. And so, people may not be receiving what you have to say well, even though it's not like your intention to come off towards people that way, but this may be the way that they're perceiving it. And so, I think it's been really good for him because he's had a lot of issues at work, and so he's expressed like finding our sessions beneficial because he's like, well, okay, now I see myself thinking like, well, he's like, he actually told me which I left. He was like, now a lot of times in the situation I think, what would Ashley say? And so he's like, well, okay, now I don't say the stuff that like I feel like I want to say. He's like, or I try to say it a different way, based off. And so that's been something as far as cultural awareness that I've really had to like be open to hearing what he has to say, but then also like having that like give and take relationship of, well, I'm going to teach you what I know and you teach me what you know, so that we can work together to help improve your situation.
Yeah, great example. Yeah.
I was just also dealing with, I work with the homeless, and so dealing with the culture of poverty, and we have a lot of people who, that's a whole, in reproductive loss, is a whole other culture. We have